They call themselves a breeder. We have that kennel, we have this kennel, it is in the farm. All these nonsense bullshit stories they give and sell the puppies, unhealthy puppies.
Hello everyone and welcome back to another episode of Pets of Family. If you are a pet parent, an aspiring vet student, planning to enter the pet business or simply a pet lover, this episode is definitely for you. Today we are honored to be joined by one of Bangalore's most experienced veterinarians, someone who not only chose this unconventional career path decades ago but also helped shape the veterinary ecosystem in Karnataka. Meet Dr. Dheeraj Kashyap, a seasoned veterinary surgeon who completed his bachelor's and master's in veterinary science from Bangalore Veterinary College in 1987. He went on to establish Indira Pet Clinic, one of the first full-service veterinary clinics in Bangalore. In 1998, he also founded the Bangalore Kennel Club, organizing pet shows and dog events where he served as a president and secretary till 2008. Let's listen in as Dr. Kashyap walks us through his journey in the pet care space. I hope this conversation brings value to you. So let's dive right into this episode without further delay. Thank you so much for coming to the show, Doctor. So, I request everyone, introduce yourself in 1 minute.
My name is Dr. Dheeraj Kashyap. I'm a veterinary surgeon and I have put in about, 39 years of practice. I started in 1986. 1986. And then I have a hospital by the name Indira Pet Hospital in Indiranagar that I started in 1986. And now I have another hospital called Pets First. It's a chain of hospitals. We have 2 branches. We're hoping to come out with some more branches.
Wonderful. And that's where Lorem was treated.
Yeah, there are about 16 to 17 junior vets.
Wonderful.
Working with me.
Wonderful, Doctor. Tell me how the veterinary scene was back then in 1986. How did you start? How did you get into this profession?
Veterinary profession, well, then it was, not explored by the, the freshers who finished their PUC and all. PUC science, we need to take PCMB. After that, everyone used to opt for either MBBS or BE, things like that, or they used to go for LLB or something like that. But in my case also, to be frank with you, even I didn't know that there was a course called as veterinary existed. It's called as BVSc, Bachelor's of Veterinary Science.
Oh.
My uncle, my father's elder brother, so he insisted that I do veterinary science because his friend's son, he graduated from University of Agriculture Science in the BSc Horticulture.
Okay.
So through him, he came to know that the course called as veterinary existed, and then he told me, why don't you join this course? I said, okay. And he brought in the applications form, everything, and then that's how it happened. I joined. But I got admissions in BE.
Was it easy to get into?
It was not that easy, but for second list, third list, for the veterinary you mean?
Yeah, veterinary, yeah.
Veterinary, definitely it was not easy. Then it is not easy even now. Though I had got very good marks, more than 87% I had scored in PUC then, I got my seat in veterinary science in defense quota because my father was in Air Force. He's ex-defense. And that too I got in third list. First list I waited, no. Second list, no. Then third list, somehow I got the seat. And then it's a course of 5 years. Now it is 5.5, then it was 5 years. After me joining also, for about 6 months, I didn't know still what veterinary course meant actually. Because initially, 2 trimesters, it was trimester every 3 months once. We used to learn sociology, psychology, English, statistics, biochemistry, things like that. So it was just like, again, repeating the PUC course. Then after 6 months, we were introduced to basic veterinary science like anatomy, physiology. Then I came to know about the basics of veterinary science. And it was quite interesting. Like dissection, dissecting the bodies of different animals, especially the bovines, the dogs, the equines and all. It was very, very interesting. Though it was very, very tough, it was very interesting.
Oh, wonderful.
Yeah.
So how was the pet industry seen back in 1986? So Bangalore was always known as the pet capital of India. Was it as big as this? Or?
No, definitely not. Back then, there was not much awareness about veterinary practice and all. See, then people used to keep pets, but the pet population was very, very limited then. And even the veterinary profession also, it had not grown as it is now. Pets used to be given the basic vaccination or deworming and some medicines for ticks and fleas. These were the only treatments available back then. Of late, maybe I would say from 2000 onwards, it started picking up because of the technology, and people came to know about the different breeds, how to bring them up, and they were used to internet. They used to go to the net and then find out about the different breeds. They started importing different breeds of cats and dogs from different countries. And a lot of people, it was a bit lucrative business also for a lot of the people. They used to bring the imported breed, they used to breed and sell them here. And Bangalore and Mumbai were the main hotspots of pet breeding in late 90s, early 2000.
Early 2000.
And a lot of people used to buy puppies from here and then sell it to different metro cities like Delhi, Chennai. And all. So it all
Is it because of the
like
weather?
That. Because of the weather, which is very congenial, and veterinary practice. And economically, Bangalore was more economically viable also. And here, services by the veterinarians were easily affordable also.
There were plenty clinics back then?
Pardon?
There were many clinics?
Not many clinics. When I started my practice, mine was the second clinic in Bangalore in 1986. One of my friends here started in 85 and I started in 86. 86. But then it was only in the evenings because I was doing my master degree then. I used to come only in the evenings and practice in Indira Nagar. It was a very basic clinic then, maybe one table chair and one treatment table. And people were not aware about the surgeries and all those things also. And back then there was not much diseases also prevalent then.
No parvovirus?
No. Parvo was there, but it was not that rampant then.
Okay.
After I finished my post-graduation 87, I was working as an assistant professor in the college, in a veterinary college in Hebbal. But it was only evenings only. And in 1990, actually, I resigned my post there and made the clinic, Indira Pet Clinic, a full-time setup. The practice was very good. People were very surprised to see a veterinary clinic in Bangalore. Back then, it was the posh clinic only. I had established then only. And we never used to have imported vaccines and all back then. It's only vaccines which were available with Indian company, like Indian Immunologicals or Hext company. We used to use that. That's it. And few of my friends, they were in abroad. They used to send me some vaccines now and then. So I used to procure the vaccines like that. And later on, some people from Delhi used to import, and then slowly distributors started getting the vaccines from abroad. And
what made you start the clinic instead of going and finding a job? Because most of the doctors I have spoken to, they practice elsewhere for some time and then think of starting their own. Like back in 1986, how did you have that courage to start? Is it because of the support or?
I was young and just very nascent in this field. Then I was offered a government job also by Karnataka government. I was given placement at Gulbarga, where I didn't go. Then only one thing in my mind was that I should start a pet practice. Either now or never, we decided. Then we had some clients because basically we were also visiting quite a few places then in Rajajinagar and Yeshwanthpur, Mahalakshmi Layout. Indiranagar also we had a lot of clients. And clients also motivated us to start the place,
Purely
Then
through word of mouth, right?
Pardon?
It was purely through word.
Yes, purely through word of mouth and the will in us to start a clinic and sit in one place and treat the animal. And we wanted to give all the services under one roof. Like pet shop. Pet shop concept was not available then. It was only basic treatment wherein we used to perform surgeries, basic surgeries only, not that complicated surgeries were not available then. It was only in veterinary college they used to do. All basic surgeries we used to do. Of course, my teachers also helped me. My teacher, Dr. Vasan Shetty, Dr. Ranganath and all. Actually, I learned surgical techniques from them only. So whenever there were surgical cases coming to us, when people came to know that there's a clinic in this place, definitely they started coming in for surgical procedures and all. But since I was very new to this, I was familiar with treatment aspect only. And to be frank with you, when I was in the college in the final year, either in the surgery or medicine department, I was hesitant to give an injection. I never used to do intravenous cannula and all. Of course, now the cannula, everything has come back. Then it was only the needle we used to poke and find the vein and all. Those things I never used to do in my college days also. After starting the clinic, I was compelled to learn all these things. And within 1 month's time,
You picked it up.
I picked up, and my friend Nataraj was also there. And so we both somehow managed there. Whenever there is a surgical procedure inquiries, we used to talk to our teachers at the veterinary college. They used to come and perform the surgeries. And then that's how I started learning surgery from them. It took only 6 months for me to learn surgical techniques from them.
Oh, wow.
And then from then onwards, I used to do my own procedures. And now I think I've mastered it, but still I'm learning.
Nice. Beautiful. So back then, people knew about all these things because there were not many foreign breeds, right?
There were not many when I started, but maybe 10 hours.
So they all does the surgery and the treatment differ to breed, or how is it?
No. Treatment and surgical procedure is one and the same for either a street dog or it is a pedigreed dog. But only thing is, the sad part of that, highly pedigreed dogs are more prone for disease than our local dogs because they are very much resistant, and the immune system in the pedigreed breed dogs is a bit low compared to our desi breeds. So slightest change in the environment, they are susceptible for various kinds of viral diseases, bacterial infection, then skin ailment, and moreover, as people started getting imported breeds into our country, a lot of genetical issues also started, cropping up. Like there are these pedigree breeds of what I have seen in my practice, 30 to 40% are genetically prone for one or the other disease. Maybe it's a kidney disease or a hepatic disease, or be it orthopedic disease, especially condition called as hip dysplasia, which is very, very, very common
in the larger breeds.
In larger breeds, especially like Saint Bernards, Rottweilers, German Shepherds, and Great Danes, and like that. This hip dysplasia, it's 99% we attribute to genetical problem only.
Is it curable?
It is not 100% curable, but it is only a management aspect. And it is a very painful condition for the pet. And surgeries can be done, but even after surgery, I don't think so there's 100% recovery. After that, some amount of pain and discomfort will definitely be there. The pet has to live its life with that, with some medication and all. That's purely management. This is all because of the mistakes what the breeders do. Because suppose one pet is detected as hip dysplasia, you should not breed that pet at all.
So it is passed on?
Yeah, it will pass on to the next generation. Suppose if there are if you made a pet diagnosed with hip dysplasia, either mother or father, both sexes are affected by hip dysplasia. If they deliver 5 or 6 puppies, not necessarily all the pups need to have this issue, at least 1 or 2 will have. Though even if the parents don't have, they can get it from the grandparents also. So before mating, you have to make 100% sure that the generation of this particular breed, what we are mating, does not have any of these genetically prone diseases. But that you have to get it from the breeders only.
But they don't check all this.
They don't check.
Because at the end of the day,
Yes,
the pet
yeah,
parents
right.
purely go by what how the puppy
Yes,
looks.
yes. Well, they see, oh yeah, this one looks very good, this male. We want a progeny from this particular male only. They're not bothered whether poor fellow, that guy has any history of any ailment. They need to check. And it's very unfortunately, even the owners, they don't tell. They want their pet to be mated. They say, okay, and get it mated. So that's what is happening. There is no any system where there is a selective breeding of any pets. In Western countries, there is. You have to take a permission to breed a pet from a known person only, where his records are okay, correct, without any ailment or known diseases. And things like that prevail even now, till date, in foreign countries, whether it is Western countries or Eastern countries also. But in India, there is no such procedure. It is very, very rampant, indiscriminate breeding, what we call. That's really sad and pathetic. See,
But KCI doesn't look into all these things.
there is no any strict norm from the kennel club to
Clubs, okay.
breed.
Even the local kennel clubs don't get involved in it.
No. See, I was a member of Animal Welfare Board of India for a long time. There also we had brought in a lot of measures to curtail the issues of indiscriminate mating. But it doesn't work. There is no any strict guidelines or rules laid down.
By the government. Then.
Yeah.
Okay.
Nobody is bothered about
Nobody's
that.
bothered. Great. So back in those days, did people really consider pets as family, or was it just another guardian? Or
No, they used to. Definitely, they used to consider the pets as a family member only. But as I told you, there was not much of awareness. Awareness in the sense, see, my parents, for example, we had a pet at home. And we used to feed it whatever we ate. Definitely not the leftovers, but I have seen a lot of people giving the leftovers. So dogs were meant for that only, eating leftovers from the house. That system even prevails even now also, but it is very, very less compared to those days. So they were definitely attached to the pet, but I don't consider that as 100% attachment. Nowadays, a lot of people get the pets. 70 to 80% clients what we have, they are really a true pet parent. They bring in the pet and treat it as a own family member. And they give it the utmost care required, be it the health care, be it the whatever is a fabric dressing or the food, whatever. That is only because, see, these things were not available then in those days. Maybe I'm talking about 30, 40 years back. There was no any food industry then. So definitely people were not aware of the food. Nowadays there are a lot of ready-made food available, which is easier. And these foods are balanced food. And people are aware that it's a balanced food and this particular breed has to be given this particular food and this particular quantity has to be given and this particular time they have to be fed. Not feeding always, maybe 6 to 8 hours gap. So all these things we as a veterinarian educate our customers. So back then this was not available. So we get a pet, we just keep a pet. No doubt we love it, but pets were deprived of all these facilities which is available now. Now I have 2 pets with me.
2 dogs?
Shih Tzus. Both, I have 2, mother and daughter. I don't intend to mate them. They are our life.
Okay.
They sleep with us. Everything. They are with us only. And slightest one day, if my pet doesn't eat, my wife calls me, oh, she's not eating. I get pissed off. Being a veterinarian, practicing for so long. See, that is the bonding we have. And we also feed them whatever they want, actually.
Do you think this pre-packed food has really hampered the lifeline of dogs?
No, it's not about the food. Food, whatever is available in the market, it is a really balanced food only. There are a lot of food available in the
Like
market.
kibbles and all that, that's good.
Kibbles is good, but I don't agree 100% with them. They do have a lot of preservatives in them, some medications, which are not that good for the pets. See, in our practice, especially cats nowadays, owners, they prefer ready-made food
The
only.
tin food and all that.
Tin food or dry food, kibbles, whatever it is. In our practice, what we have seen and a lot of seminars and conferences we have attended, what I gather from that information is pets which are only on ready-made food, they are more prone for kidney stones. I'm sorry, the bladder stones, stones in general. And then maybe gallbladder stones also. What I come to know is this is because of the preservatives, what is added in this dry food. And they have to undergo surgery for the stone removal and all. And same thing what I have compared is the pets which are on home food, they have not seen any pet on home food having this issue. This, I think it's a major issue. It can be corrected.
Okay.
And we do advise the pet owners about the advantages and disadvantages of the dry food.
Oh, got it.
70% what I have seen, they have one or the other issue.
One or another.
And pets do need, though we say it's a balanced food, I don't agree it is balanced food. Some home food is definitely required.
Okay.
Like carbohydrate or proteins or fiber in the form of vegetables or rice, whatever it is. Boiled egg or chicken. Basically, they are carnivores. We are depriving them of this one. So definitely, I strongly advise and suggest that pets need to be given some home food also.
Correct. And that's exactly what I'm doing with my dogs. I have a combination of both.
Yes.
So when did you introduce X-ray, ultrasound and all that? Because back then, I don't think so Bangalore had all this kind of equipment.
Then it was not there. And if there's any X-ray required, we used to refer it to veterinary college at Hebbal, to our teachers. They had X-ray unit, but they were all old and outdated now. Now they've got all latest instruments and all. Back then, it was X-ray was available only at veterinary college, and we used to refer cases there, and they used to give us in writing what they have diagnosed and what the treatment should be. So that's how the client again used to come back to us. This happened for about, say, 10, 15 years. Then I started with X-ray unit and ultrasound about 15 years back.
That's recent, right? 15 years back.
Quite recently, only 15, 17 years back I started. And then nowadays we have laser also, even that I've introduced then. No, after I started practice, there are a lot of clinic and clinics have come up after 2000. In 2005 also, in Bangalore, there was some big clinics come up, youngsters, and they started procuring X-rays and ultrasound and all. So they had also inspired me. They're all good friends of mine. So then I thought, so why don't I have all these things? So that's how it happened. I also immediately procured those things, and it's all done. All facilities we have under one roof now, like a laser, ultrasound, scanning.
All in Indira Pet
Everything at Indira Pet
Both
Clinic.
Pets First and Indira Pet Clinic.
First, we have updated the latest equipments also.
Wow.
Pet First has everything. You name the equipment we have, like BP, Doppler, ECG, even we have in the Pet Clinic. And all hospitals, wherever I go, is equipped with ECG and Doppler, everything. And then Woods lamp called to detect, to know and diagnose if there's any particular fungal infection in a pet. So those things we have.
So this is a little controversial question I wanted to ask you. So I recently went to this Delhi event. Okay, there I met a lot of industry people, the pet industry people. So most of them are against breeders. Okay, but I feel that industry is running because there are foreign breeds. Yes. Like for example, as soon as I got into this industry, I noticed that every pet food brand labels you see, right, there is no indie dog picture on it.
Yeah.
You will see German Shepherd, you will see Rottweilers, you will see all those kind of pictures on the food. Now, when they're opposing breeders, and when people have fancy breeds, and fancy breeds are the one giving the business, then why is the industry opposing breeders? Instead, can't the industry get together and correct the breeders?
No, this has been happening for a long time now. And as you mentioned, there are posters of imported breeds on the food packets because the food industry, mainly the, what do you say, renowned companies like Royal Canin or the Hills or Waltham, Pedigree and all, these are all abroad companies only. So these are the ones who introduced food in India long back, maybe about 25 years back. Maybe, 2000 starting. These food were introduced. So definitely these breeds, what you see now, like Saint Bernards or Golden Retriever, German Shepherd, these are all European breeds. And
But even our Indian brands have started putting them on their label. Like
of late now,
Yeah.
that's how it started. Food coming from there, and all breeders were fascinated about that. They started using that
to
food.
compete.
Yeah. And these breeders, they are, they have to upgrade their knowledge about breeding and all. I don't condemn all breeders. There are a lot of breeders who go for the dog shows abroad, and they learn a lot of things. Like the health issues or the upbringing of the pet and feeding types for the pets and all. They come, but there are some breeders who are thinking only on the commercial aspect of that and not the health aspect of the pet. And they want to make a fast buck. They don't mind selling a breed, as I told you, with any genetical issue or feeding them the food which is available in India. There are some Indian food also which is equally good as imported food. They started using that. And now, see, these food companies, they start tapping different breeders by offering them discounts, a lot of discounts. You take one bag, we will give you two bags. So this basically corrupting the minds of these breeders. So they're, as I told, they're more on the commercial side. They are compelled to use that particular food, which we don't recommend. We don't trust that food. So that's how it's happening.
You think this will continue, sir?
I don't think so. It will continue. We definitely condemn. Whenever a customer comes with this particular food, this breeder had told us to use this particular brand only. We condemn. No, it's not like that. You should be aware of the present food, whatever is available in the market. There are a lot of reviews, then the internet available. Go to that, and we tell you our own experience and guide you to use this particular food because this has these things, and this is the disadvantage of using this food. There is breed specific food and age specific food. So things like that, we try to educate them. People are definitely changing. They don't completely trust the breeders and all. So definitely the food industry is the bigger industry. They also conduct a lot of seminars at the breeders level and also the pet owners level.
I doubt if they're doing it, sir.
No, they are doing. A lot of people
Apart from sponsoring, because I've been to a couple of dog shows, and I don't think so they're actively doing it apart from sponsoring.
No, they do sponsor, and a lot of people, it's like reputed companies, I would say, like Royal Canin, and then the Pet Star, and then what do you call the Hills Company. All those people, they come to the vet, and they target some cream breeders. They go to them. They visit their kennel. They get their history, and through them they try to promote their food, which they are doing effectively. And they approach. We have an association, Pet Practitioner Association of Karnataka, which I, along with Dr. Narendra, we started about 25 years back.
It's still active, sir?
Yeah, very much active. And then a lot of companies, they approach us. We give them the platform to exchange their knowledge. We conduct seminars for the doctors, who in turn educate their clients and the breeders. And then we give them the platform to educate the breeders in general. So things like that are happening. This is called as continuing education program. This continuously goes on every 3 months, 6 months. We do have programs like this.
Do you think a formal education or training is required to become a breeder?
That is always required.
Always required, because
Yes.
when it is required to become a trainer or even a doctor,
Yes.
you need to go through certain education and training.
Yes.
For breeder, it's quite open. Anyone can become. Even to get a KCA certificate, it's so easy.
Easy, but one thing, the pathetic condition about this is, anybody, now about say 15, 20 years back, even a college going student, he acts like a middleman, procuring the puppy from somewhere. And then those days, internet was not available. It was only paper advertisement. They used to advertise for so-and-so breeds are available. So people used to go see the advertisement, call that number. That number used to be of the middlemen. And middlemen were a lot of students only.
No.
Yeah. So they used to talk to them. They used to fix the price. They used to pick up the puppy from somewhere without knowing the health issues or anything. And then go to their house and sell them the puppies. And they used to make a fast buck. And they started calling themselves breeders. They are not the actual breeders. So that was very wrong. And then off late, even now this is prevailing. A lot of middlemen, they call themselves a breeder. We have that kennel, we have this kennel, it is in the farm. All these nonsense bullshit stories they give, and they convince the potential customer, whoever calls them, and sell the puppies, unhealthy puppies. All these unethical things used to happen, which is happening now also, but we are curbing most of them. Once they get now even the breeder, so-called breeder, they start vaccinating the puppy themselves without knowing the importance of the vaccine, what vaccine has to be done, at what age it has to be done. They say we have vaccinated one dog. And one guy calls and tells, when the client comes here, he says, sir, the pet has been vaccinated. What vaccine? They don't know. They are very lame to that one. They give us the phone. When we talk to the person on the other side of this thing, sir, one vaccine we have done. One ಮಾಡಿದ್ವಿ sir. 2-3 ನೀವು ಮಾಡಬಿಡಿ. What vaccine? He doesn't know. There is no record of that. Once vaccine is done, we need to put the sticker and the expiry date of the vaccine. Not only that, the vaccine means it has to be always kept in a cold condition. That cold chain they don't maintain. So even if he's vaccinated, without a cold chain, what is the use of vaccinating? Then again the pet is susceptible for diseases. So this is a very complicated issue.
It's a vicious cycle.
Yes, it's very vicious.
Yeah. Cool. Things that I've been observing since I entered the industry. Thus, I asked you this question. Now, coming back to the hospital. So, Indira Pet Clinic, for how many years did you run it in that first location, sir?
First location, I started in early 86, 85, I finished my degree. Then, as soon as I finished my internship, me and Dr. Dheeraj, we found a place.
Was it profitable, sir, when you ran it?
Yes. From day one, it was very profitable. You know, in those days, my first day, I earned 900 rupees then, which is worth 90,000 now. 900 rupees I earned.
1986.
Because, see, for me, it was not a clinic immediately. I started the clinic because of the motivation from my clients and my friends and all. So the day I started clinic, we invited a lot of our existing clients also. So they came for puja and all. We did that. So I made about 900 rupees that day. Wow. Of course, that particular day, it was a full day from morning till night. And then subsequent days, it was only in the evenings only, since because I was free for about 2-3 months after my degree. After that, I joined post-graduation. So I used to come in the mornings also. And it was very new to me. It was very thrilling, and I was very happy.
So it was better than going and getting a job.
Yes, yes.
Doctor, you also started Bangalore Kennel Club. Tell me that story.
Bangalore Kennel Club, we started in the year 1990. One of my friend, Mr. VG Paneer Das, the VGP group of companies.
Oh, VGP?
Yeah, he is the chairman of that. And then he approached me. I was with the Kennel Club of India before. as an executive member there. And one of our doctors, late Dr. B.C. Ramakrishna, was there. I was associated with him after my degree because he used to run Kennel Club shows and all then. I was closely working with him, and he was into SPCA NGO. I was with Dr. later B.C. Ramakrishna. So this guy, this friend of mine, he came to know that I was with him, and he started a kennel club called as Bharat Kennel Club in the year 1990. So he came and approached me and asked me, why don't we start a subsidiary club here in the Karnataka state in the name and fame of Bangalore Kennel Club, and why don't you, since you already have some experience with Kennel Club, why don't you take charge of this and do it? I said, okay. First year we did our dog show. It was very, very vibrant in 1990.
In Bangalore?
In Bangalore RSI ground.
Oh.
We did. We do a lot of crowd there. Good gathering. Good number of stalls we had. Stalls those days were very numbered because there was not more of pharma companies and all then. No much of pet shops also then. Since I was a bit familiar name in the canine industry then, it was about 6th year in my practice then. So I requested all the companies which were existing then, like Alembic or Ranbaxy and some pet shops, to name a few, Mr. Sharif, Bright Shop, and Glennon's and Nathan. They were all my good friends then. They're also still very good friend of mine now. They all participated by putting the stalls and all. Then they sponsored also good prizes then. We used to give big TVs and fans, something like that. We used to give. A lot of people were interested, and a lot of breeders also, they participated. So after that, there was no looking back. I was named the president of the Kennel Club then, Bangalore Kennel Club. Then I started along with Dr. Dheeraj. He was the secretary. Though he was in a government servant, he was a block development officer also. Gradually, he shifted his profession. And then it was an untimely demise of Dr. Dheeraj. In 2005, he passed away. I started conducting dog shows till 2008. And after that, I was not that much of interested.
Okay.
Then
Is the club is still there?
no, the club is not there.
Okay.
Yeah. And then a lot of doctors who are at present, the president and the secretaries and the club members of the present Bangalore Kennel Club of India, they were all my friends only. They were all youngsters then. They were all with me, helped me to run the shows and all. These people are now running the Bangalore Kennel Club or Silicon City Kennel Club, whatever you call it. So they are continuing these under the name of these club. Yeah.
Oh, wow.
Yeah.
I have another very interesting question. So 39 years of driving 14-15 kilometers one way every day. Back in those days, it was pleasure to drive in Bangalore. And you're
Yes.
still doing it.
Yes.
Working from 9 to 9 o'clock.
Yes.
What keeps you going and what drives you to do this?
Nothing.
Today, I am so sick of driving 2-3 kilometers, and how come you wake up?
No, me, I love driving basically. Though I have two drivers, I drive myself wherever it is, not to the clinic, even any outside we go or any function. I don't call my drivers. I drive myself, and I drive every day. I start at 9:30 in the morning, come to the clinic. I love attending clinics, though I have a lot of doctors taking care of the clinic, but still I come. I be with them, I see how they treat.
Nice.
I'm very confident they are treating good, but and I also join them in treating. Though I have seen almost all the cases, I enjoy being there, talking to the customer, my clients, and then talking to the pets. I don't know, it gives a lot of energy in me.
Wonderful.
And I go
39
back
years
at
of
10 o'clock, 10 p.m. And my wife and daughter, they're used to that. Initially, they were very, angry with me. But I regret for not having spent my quality time with my daughter, who is abroad now. I regret now that I was not with her during her school and college days.
Nice. Now, next question. How did Pet First Hospital happen? You are running Indira Clinic, and what's the story behind Pet First Hospital?
See, Pet First Hospital, it happened in Mr. Manjunath. Basically, he's an engineer by profession.
I
He's a
know he was
mechanic.
here in one of the episodes.
Oh, yeah, right. And I came to know Manjunath about, say, 4 years back. And even he has a lot of dogs. He has a big farm. And then he's an ardent pet lover.
Yes.
He is a genuine breeder, I say, because he has a lot of love, compassion, and he is not a commercial guy,
He is not.
you know. So he used to bring his ailing pets to me, especially with parvo and some, say, diseases which need require treatment for about a week or 10 days like that. So he used to bring the pet from a distance of 40-50 kilometers. He has his farm somewhere in Tamil Nadu, Hosur border, Hosur. So he used to bring the pet on his own with his worker. He never used to send it through some guy, go get it treated and bring it back. He never did that. Every day for the drips or treatment, morning, evening, I say this particular pet has to be given fluids and drips and medication morning and also evening. And late night, he used to come by himself with his assistants, carrying the pet by himself. So I used to see that this happened for many months, about 1 year. And then I didn't have the idea of the hospital. Over a period of time, Manjunath thought, see, I am getting the pets to the hospital. There are a lot of other, there are not much hospitals in Bangalore which are 24/7 and which can afford treatment to the clients at an affordable rate, I mean. And with high-end machines, rather diagnostic tools, I call. So he had in mind, why don't we start a hospital like that? Say, I'm bringing my pet. A lot of thousands of pet owners are deprived of this one. So why don't we start a hospital? Then over a meeting, just talking casually, he asked me, so why don't you join me? We'll start a hospital which has all the amenities and facilities which will help the pet lovers and the dumb animals. Then initially when Manju came with this idea, I was a bit hesitant. Then every now and then he started, pestering me, no, you have to agree. Because of your, maybe he would have thought that because of my experience in the pet industry, he wanted me to be with him for all the technical issues and all those things. Then I thought, yeah, his idea is a very noble idea. Why don't we support his ideas and all? So that's how we came up. And then he took me. He didn't take me actually. He went, finalized one place and came in Kalyan Nagar.
Yes.
And then because he knew I'm not, I would have not accompanied him. Suppose if he calls me to come and check on the places, then we put in all the equipment, and from that day onwards, no stopping.
So I'm sure you performed thousands of surgeries.
Yes.
Tell me one which was very challenging and very bizarre.
It's not challenging. Challenging surgeries are many. Once the cat, it came with a huge mass in the stomach. Then we did an ultrasound. It didn't reveal anything. It showed some mass near the spleen. We did an X-ray. And then I sent that pet to my other friend in Cuba, Dr. Wasim is a very good friend of mine. He said, sir, even I find a mass. You open and see that one. That is called as exploratory laparotomy. I did that. To my surprise, the tumor had spread from the spleen, the whole length of digestive system, the intestine, just like a cauliflower growth. I don't know how that poor kitty was surviving all these days. I think this was more than 8 months to 1 year.
Wow.
But in spite of this, the kitty was eating. Though the belly was enlarged a bit, she was eating, pooping was normal. after I opened the whole thing, even a reproductive organ, it was a female. The ovaries, there were a lot of cyst and, mass on that. The fallopian tubes, the cervical area, the complete thing was, I had not seen any cases like that.
Wow.
And then I felt really bad. See, in diagnosis too, whether scanning or a second opinion, it didn't reveal any of this one. Only then, after opening, only we came to know. Then I called the owners into the OT. I showed them. We had a video of that. Even they were very much, aghast at us. What do you say? Felt very bad and surprised. Then the only option was to put the pet down. Again, we can't close it up and start on the treatment for the thing what we observed. That was not feasible at all. That was a very complicated and problematic case, I feel. Then owners also was very much, then we need to put that down. We had to put the pet down on the table only. That was a very, very sad thing.
So, what's your view on the evolving pet care space in India? So now, right after COVID, the pet adoption has increased, and every household, every second home or third home in Bangalore especially will see some other pet.
Yes.
So where do you think this industry is heading towards? Some people say it's going to grow beyond what it is. And with this, do you think education is required? Do you think more hospitals are required? Where do you think we're heading?
Pet industry definitely, in general, veterinary practice and the pet industry was definitely growing from 2008-10 onwards. Then suddenly, because of the COVID, there was a block, gap. Then during COVID, surprisingly, all the pet hospitals and the clinic were crowded.
Really?
Except even our pharma business, I told you I own a pharma distribution center also. Our daily requirement was double during COVID. Supply was doubled. And our practice also. Wherever we used to say about 60, 70 cases, we used to see more than 100 cases. This was during COVID. We were also very surprised. I think that was the only industry during COVID did well, boomed prior to that. Now, after the COVID, there's no looking back. It's moving further. But I think there's a very, very vast, good scope for the pet industry after COVID. Lot of pets adoption, especially the feline industry, cat adoption became nearly double, I think.
Nice.
So, for instance, we used to get about 10, 15 cats before COVID. Now we are getting minimum 30, 35 cases of cat each day.
Each day?
Cat. In our one hospital, Indira Pet Clinic, and our Kalyan Nagar hospital, Pet First Hospital is seeing minimum 40 cases of cat only per day.
Every day.
You just imagine that one. And this scene is same all over Bangalore and all over India.
In between, there was also news that pets were also a reason why COVID is spreading. And I remember reading that in the newspaper, and a lot of pets were...
that was only a propaganda. People thought it could be. Even pets do have coronavirus. The disease, what people think, corona. In pet, it was much earlier, more than 15 years back, they had corona. Even vaccines were also available. But this human corona and the pet corona is entirely different.
So my last question, what is that one thing that you really like about today's practice, veterinary practice, that didn't exist when you started your career?
See, now everything is very handy. And we do not feel that we are not deprived of anything. We are well equipped to handle any scenario, any cases today, which I feel that we were definitely deprived, our generation vets. But generation should not be a reason. We need to update ourselves day to day. See, now I started attending so many seminars and conferences back then. From 2000, I started attending. And our association, Pet Practitioner Association of Karnataka, We have lot of vets. We send them. Our association in turn, it is affiliated to the international association, so they do a lot of workshops, lot of conferences. So a lot of doctors, go and attend such cases. So day-to-day update will definitely be there, which is very much needed to our industry. So I don't feel that I'm deprived of anything in the present day now. I feel I'm equipped, and I try to every day equip myself with the latest technology and treatment available in the field now. And I'm happy that we are doing a great duty, and it is our bound service to treat the dumb animals, because their love is unconditional love.
True.
We should have need to be humble, and we should have a lot of love, and moreover we should be more of compassionate towards the pets. They don't demand, we should.
Last question, doctor. What's next for you? I see that you're scaling pet first hospitals across Bangalore.
Yes.
You're opening multi-centers, and so you will end up working more than 12-13 hours now. Is it true? Or
No, most of the administrative work is taken care by my friend Manjunath, and we have already started a branch in Jayanagar. It's about 1 year old now. We're doing very good there. We are upgrading that hospital also.
Wonderful.
And we are planning some more centers, high-end centers in Bangalore, and we are planning pan-India also with high-end hospital and high-end pet store also.
Yes.
Our basic motto is the clients should, it should be easily affordable. Be it pet shop or be it our treatment, it should be easily affordable. And we are coming out with a pet first app also. We are working on that.
Nice.
And I think we have done a trial on that also, so that the services, the veterinary services, can be given to the pet parents at their doorstep.
Our best wishes for you and Mr. Manjunath and the Pet First Hospital.
Thank you.
And thank you so much, doctor, for coming to the show.
Thank you very much.
I really wanted you to be here for many, many reasons. One, to save my dog, and special thanks for that. And I see that your emotion or the way you handle the customers has been passed on to the doctors there. And that's the best part about the Pet First, and I've been recommending that hospital to all my friends.
Thank you.
Thank you so much.
Thank you very much for inviting me. Thanks once again. Thank you.
If you like this episode, don't forget to support us, share it with your friends, and if you know someone else doing amazing work in the pet space, recommend them to us. We'd love to bring their story to you. Until next time, stay happy and keep loving your pets.